One of the most challenging complaints we see in urgent care is abdominal pain. And not because it's something dangerous, but because we have very limited tools to work with. Your MP Pal here, and welcome to another lesson from the tracks. All right, so I wanted to talk about abdominal pain in urgent care because this is such a common complaint that patients come in, it may be going on for a few hours to a few years and everything in between. And the problem is, all you can really run in-house is a UA. You know what I mean? It's like, oh, yeah, sometimes I have diarrhea, sometimes I'm nauseous, sometimes, and it's like, there's no testing to really do. There's typically no in-house labs. I know some places do it, but very few, but there's pretty non-specific. So that's the downside to it because it's such a common thing. And they're not like really sick enough, you know what I mean? Like they're not crashing in that moment. So it's not even like, hey, you need to go to the hospital right now. So this is something that you see probably want to shift, okay? So just want to talk about how I approach it. So typically, the most common ones I see are ones that's been going on for a few months, right? They don't have a PCP, stomach been hurting for 4 or 5 months, and then today they want to come in to see what's going on, right? And then all of their symptoms are vague, non-specific. Yeah, it hurts sometimes at night, sometimes in the morning. Nothing that really helps you, right? And then it's like, you don't even have any testing to do. You do the UA, it's clean. So what do you do for that, right? So I initially would kind of start off like, so this is an urgent care and we have very limited resources. Again, I always blame it on the setting because patients will look at you like you're limited, right? They're looking at you like, oh, you don't know what's going on. Well, there's only so much I can do in this setting, and there's not like a quick little test that we can do to figure out and get you some answers, okay? So that's typically how I'll start it off, and I'll just kind of let them know if it's something that you do need additional testing for, right? So, like if it's an elderly patient, anybody 60 or above, I definitely start the conversation with, so in the ER, there's typically a protocol, like where I used to work, there's a protocol that said, like anybody 60 or above with abdominal pain, automatic CT, like automatic. So I usually kind of like to put them in that setting. So in the hospital, typically anybody over this age range automatically gets a CAT scan, okay? Because it can be so many things. And so it depends on their severity in that moment. Are they stable versus unstable? But I like to just tell people that way they kind of know, right? But I'll run the UA and I'll just kind of tell them. And then the other, next test for that abdominal pain is an ultrasound. But with that, what are you actually looking for? So it can pick up some gallstones, ovarian cyst, if you have any testicular problem, things like that, it can kind of check that. For a female, you can do the pelvic because that is like females add more options to the differential list. So that really makes it more difficult. And so I just tell them from the get-go, we're limited. I can do a few things here, but you may need to follow up and go see someone else. Just remember, GI referrals, that's what they're for. I use those all the time, just about every case. Like I'm gonna tell them, so if it's something where they're sick, like right there in that moment, you need to go to the hospital because you need a CAT scan. And the reason is, I don't remember the last time an insurance company actually paid for an outpatient CT. From an urgent care standpoint. Primary care may be different, but urgent care, I used to get those long rejection letters. 9 pages, them telling me why they didn't think that it was necessary. So they just typically won't do it. So if they're sick enough, I just tell them, look, you probably need a CAT scan, okay? And so the only way to really do that right now in this moment is to go to the hospital. They may not want to hear it, but it is what it is at that point, okay? So again, if it's something where you have time, then you can do an ultrasound depending on what you think the problem is. But a CT is still the gold standard for a lot of things. So another thing that I see with some providers is that they order a lot of complete abdominal ultrasounds. The thing is, I get it. I know that you just want to do something. You want to do something that's been going on for so long. But with that test, what are you actually looking for? What are you looking for with the complete abdominal ultrasound? Okay, so, and I remember working at one place for this one provider, almost every abdominal pain patient, and the majority of them were negative. And so you call and give her results, and you tell them everything's fine. Okay, so what do I have then? I'm like, I don't know, I didn't even see you, right? So it's almost like sometimes giving false reassurance to the patient, because if you get like basic labs and get the abdominal ultrasound, they feel like something is being done, but then if you don't know what you're looking for and all those tests are negative, then it's like, okay, well now what, right? So you can save them a lot of time and money and inconvenience. Just send them to GI, let them deal with that, okay? I use that on the majority of them, okay? Because you're kind of costing them money, and that false reassurance that they're thinking like something is happening, oh, let's get to the bottom of this. And a lot of times, some of this stuff is intestinal, right? You know, from diet, you know, there may be some other things that's going on with that. So that's typically, I don't order complete abdominal ultrasounds. I haven't done that in years. So, and then you have abdominal x-ray, which most urgent cares have x-ray on site, but again, what are you looking for? Yeah, you can sometimes see a stone, but I don't order x-rays for stones. I don't. If they're that sick, send them to the hospital, okay? Or like the majority of the ones that we see, of course you're gonna do a UA, it's gonna be blood in there, so I'll go more on the treatment route. I'll do the Flowmax, give the Toradol, give some Zofran, plus ER precautions. And I'll just tell them, hey, you may have a stone. The ideal situation is that I give you this medicine, you drink a bunch of water, you pee this thing out, good to go. But if this does not get better, then go to the hospital. Most of the times, if you tell people not just what, but why you're doing this, they usually will receive that a little bit better. So I just tell them the situation, like, hey, you know, the true way to rule out a stone is to get a CAT scan. Depending on your pain control, if it's not that bad right now, then we can try this outpatient route. Always give ER precautions, okay? So the takeaway is just get a good history, because a lot of the information is gonna be what they tell you. Just listen to them. You have to ask a bunch of questions. You're gonna spend probably more time in with these patients, but you get a lot of information, the majority of information from the history. Of course, from the UA, GI referral, and then ER precautions, okay? And that's pretty much it. It's usually all you can do, but I would advise against over ordering, you know, getting basic labs, getting all this stuff, because you're gonna get this stuff and this probably won't even give you any additional information, okay? All right, so abdominal pain and urgent care, your RNP pal here, practice boldly, and I will see you on the next one.